They just built me a new website, and it did. So what you see today,
looks so good.
it was done while I was operating.
Oh my god.
I don't even know which phone this is. I think this is TikTok.
This is crazy.
All right, so it's TikTok, and that phone is in the way. I knew that would happen. All right, so I'm going to move this over slightly. Oh, yeah, perfect. Okay, cool. All right, so we're going to change the picture to this, I guess. No, we're not. That doesn't work. Bring back stage. Bring back. Go live. We're going to go live now. Hey, everybody. I have my special guest, Sinclair, who's really being a trooper because she's been sick. But she is the head of Detox Nation and a parasite expert. And I've had her on my podcast before. So with all of the discussion about parasites and breast implants, we thought it'd be a great idea to do this live. And I thought, oh, I should bring on Sinclair and we'll have a little chat. So the tradition is, as everybody comes on, we're just going to do a classic Joe Polish 10-minute talk for everybody who knows Joe. And then we're going to go off the lives of Instagram, TikTok, YouTube, Facebook, and Substack for all you on Substack. And then we're going to stay on Circles only. Circles is private, so we can discuss everything, and we will not be, how would you say it, bothered by our sponsors, even though I don't have any. We won't be deplatformed on my platform, so to speak. So that'll be best. So we'll let everybody hop on. And if you didn't see all the hubbub all week about the reality store who had a facial parasite and then blamed it on ruptured implants, then you missed out. Maybe you were living under a rock because it was all over the feeds all the time. TMZ. I mean, I had so much TMZ in my feed, I didn't know what to do.
I know. I thought that was. It's always funny to me when people are like, "What do you mean parasites are real? What do you mean that these things like have a relationship in the body? Like, how is that news to you?" But we have to remember that we're undereducated about parasites in every health discipline. And so, of course, it's going to be a shock to the public.
I bring it up all the time. I mean, I'm pretty well trained and pretty well educated. And I don't have my notes from med school, obviously, anymore. But I'm just wondering, was I absent the 2 hours they talked about parasites, or maybe 30 minutes that day, because I don't remember much.
Yeah, it's like, hey, if somebody comes in and their body has suddenly ballooned out a soccer ball in their abdomen, maybe think parasites if they show up in the ER, or if they've suddenly dropped 30 pounds in a period of days, then like maybe parasites because they were also in the jungle. Like that is not even close to the reality of parasites, especially for Americans. This is a slow development because of terrain issues, because of immune dysregulation. And of course we see like biofilms as the great bridge between breast implants and the immune dysregulation that actually allows for parasites to set up shop. Biofilms are the perfect nest for parasites. So it's not a question of like, have you ever been exposed to parasites? Of course you have. Every time you swim in a lake or like step in a stream, or, your feet hit bare soil, or you kiss a puppy, or you hold a child, you have the potential to get exposed to parasites. So the question is not, have I ever been exposed to some? It's more like, am I a good host to parasites? And breast implants would be one of those additional risk factors because of the biofilm formation and immune dysregulation that would actually make you want to pause and consider that.
Well, what they classically would do, Sinclair, on exams would give you the Giardia. So the case presentation would be somebody who went camping, all of a sudden had X, what do they have? And so that was obviously like, or somebody was overseas in India traveling or whatever and got bit by a mosquito. What do they have? Because malaria is a parasite,
or
right?
Montezuma's Revenge.
Correct. Yes. I'm in Austin, and we're gonna share a pretty good story. But that is a real problem here. I mean, a real problem. it is, and you're obviously close to Tijuana and everything. I mean,
Yeah.
come on. When people tell me they went to Mexico, I mean, I'm just like, okay. And I always just follow up with, and did you go off property?
Right.
And they're like, oh, yeah, yeah. I'm like, well, yeah, you got a parasite. Whether or not it made you sick is a different story, but you definitely have one. If you ate off property, drank off property, because the properties know that they have to filter just like they do here. You know, you can't go to those places and they have you, give them a -1, Google rating because you got sick at the pool or whatever. So,
Right. Yeah. Totally.
yeah. All right, so we're going to get going and do a 10-minute talk, and they're going to switch into circles. We are up on Substack, YouTube, Facebook, Instagram, and TikTok. And for a Thursday, it seems a little slow for y'all, but that's all right. Stay tuned. So we're going to do this 10-minute talk, and then we're gonna be able to pick Sinclair Canale's brain extensively because she's an expert in parasites, and I am not. So we're going to do just a brief overview, and it's not going to be in-depth. We'll talk about in-depth things like Sinclair can in the private chats and Q&A after. So parasites, as we were discussing early, inflammation, and really what are we getting wrong as Sinclair was alluding to, we're getting a lot wrong. Tonight we're going to spend about 10 minutes just talking about parasites, specifically what they are. And this is my favorite. How are they? I'm going to just say misdiagnosed because diagnosed is very difficult. And how often are they just misunderstood with symptoms that show up in your skin, your face, your gut, etc. And we're not here to gossip, and I'm not here to talk about, specifically the reality personalities problem. That's not my patient. I didn't operate on her. So that we're just going to bring this up because it's top of mind right now. And once again, we're not diagnosing anybody. So basically, parasites, there's 3 broad categories, and Sinclair can talk about it in depth afterwards. But the protozoa, the helminths, the worms, and the ectoparasites, and most of the infections, as I think about them in our country, are going to be GI related, typically. Not what was talked about on TMZ as a facial parasite or gingival. I mean, all of a sudden, I had all these things like sent to my feed, like I was a magnet for parasitic problems of the face. And how do they present? I mean, most commonly, we were discussing a little while ago, if somebody goes on vacation and they fall ill and have diarrhea, it's called traveler's diarrhea. And Sinclair was, talking about Montezuma's revenge, which, yeah, we've seen in full effect on holiday in Mexico. So you usually get diarrhea, abdominal pain, you got bloating, nausea. Obviously, that leads to fatigue, weight loss, all the things basically dehydration or severe dehydration, can lead to. And then in some cases, although rare for me, I haven't seen this in my practice, is blood work that shows eosinophilia. And I don't have anybody come in acutely ill from a parasitic infection. The people that come into me are a whole different breed that we can talk about. They do have some very specific systemic inflammation signs that I always now, I'm always top of mind thinking of, do they have a parasite? Do they have a mold exposure? Do they have a Lyme exposure? What other weird things do I need to be checking in? And maybe as Sinclair and I will talk about it, but if you can't take a good history, you probably shouldn't be doing this for a living. Because that's how most of this to me is just completely glossed over or missed in the quick appointments that have become the norm now in care. So I guess infection versus inflammation. I mean, both Sinclair and I see chronically inflamed people. I don't see, quote unquote, overtly infected people. I don't see people with fevers. I don't see people with cellulitis, which is redness or tenderness over the breast. If it was that easy, anybody could do my job because everybody would show up, big red swollen breast, whoop, they take out the implant, no big deal. What we do both see a lot of is people who have more sensitivities, not necessarily an allergic reaction, but they seem sensitive to everything, and that's a very common problem now. If they have certain treatments, we'll just say in my practice, certain people come in and say, especially with inflammation, that they overreact to filler, they get red. Like wherever the filler gets injected, they'll have redness. And they may have autoimmune type markers, an elevated ANA already, but nobody knows why.
Mhm.
There's all sorts of hormonal changes. Oh my gosh. If everybody listening knew that the number of patients that I have that have no libido and no testosterone or almost undetectable free testosterone levels, I don't know how excited everybody would be about getting that case done all the time if that was the long-term outcome. And then we talked about chronic inflammatory states, but we can speak about that. We can go on for days about that. I thought this interesting when I was preparing because, we were talking about med school, and I'm like, I'm trying to remember what they told me in med school about parasites. And I remember like Giardia, I remember malaria, and I
Mm.
remember they're like, you guys have to do ova and parasite testing on stool. And this is back, I mean, so I graduated from med school in 96. They still had parasitologists. So you could send stool off and have it looked at, and they could give you an idea of what was going on. I honestly don't think those, are they still around? Do they exist anymore?
Yes, they do.
Super uncommon though, right? I mean, it's just not that common
Yeah, it is
anymore.
uncommon.
Yeah,
Yeah.
yeah, yeah. Because I think if you take some eyeballs and look at our microscope, you'd be fascinated by what you find. But like my practice defaults to PCR testing a lot. So, I mean, you can miss things, certainly. Um, and I have not found blood work to be valuable in this instance. And I've never biopsied anybody to figure out a parasite. Um, and yes, we'll bring this up. So we did not try to make a diagnosis of that reality personality's facial parasite by looking at her video, or you can't do that looking at a selfie. Like people who think that that's not accurate. Um, the face is a really uncommon place for this. We can talk about that later, but like basically the face is the most vascularized. I mean, it has the best blood supply. It literally
Mm.
has the best lymphatic drainage. So I would say you're pretty effed if you got a parasite in your face. You're chronically immunosuppressed if that happened to you. Meaning you've got so much going on that your normal defense mechanisms can't handle that. Because that should not happen in the face. I mean, I've seen the over response of something in the face, but I haven't seen infections like that in the face really, you know.
No, for parasite issues, what's much more typical presentation is, the GI stuff is the most easily noted and trackable for somebody, and then if like facially they would see like a difficulty draining, a tendency towards, light and sound sensitivity. They might be puffy when they wake up.
Yeah.
That can also be from like, sleeping in a moldy environment. Like it's multifactorial.
Right.
A tendency towards dental infections, difficulty draining, so like swollen neck, like that kind of stuff.
So definitely so obviously Sinclair and I deal with similar type patients where they have chronic stress problems, they don't sleep well, they may have been exposed to mold, they already have gut dysbiosis and imbalances that we know about. And by far, those are the most difficult to correct over time in our experience with our patient population. And as we mentioned previously, many of them already experience tons of problems with hormonal dysregulation. That's a very common problem. So moving on, like what are the drivers? We've already discussed autoimmune drivers. I think, and I want to hear Sinclair's opinion on this. Mast cell activation has become like so common now. It was like an unheard of thing, and now it's like all the time somebody's coming in and they have mast cell activation syndrome, and I've heard it blamed on spike protein from vaccinations, but something has definitely gotten these folks, their systems revved up. I think overall, we didn't touch on environmental toxins as much. So outside of mycotoxins from mold, there's all sorts, a host of things like, the golf courses are always in the news now for atrazine, right, contributing to Parkinson's. There's glyphosates, obviously Roundup's in the news all the time now. And I just had somebody with a really high, and I hadn't seen it for a while, a really high BPA level. And I was like, oh, okay. Now, BPAs were definitely common in cosmetic products for women over time. And this was an older woman, and she just had a laundry list of things in the 95th percentile. We'll go over what I'm talking about on a Vibrant Wellness Talks test, but I was like, this is a lot. So the only reason somebody's walkie-talkie like that and not really suffering is they have some good pathways. You can't have really limited pathways and have such a bad test result and still come to my office and be like, ooh, everything's okay. That's not
So fun.
that's not normal. So all right. I guess what of our audience, what should we give them kind of some take homes before we get back? I think social media certainly amplifies all these things and brings them top of mind, which is actually good because I think you should be thinking about other ideas when it comes to somebody suffering from chronic inflammation. I don't think that should be ignored. I think that's part of the disenfranchisement of the group I take care of because they have been kind of brushed aside for symptoms of chronic inflammation that nobody seems to be able to characterize. And they don't look hard enough or they don't listen well enough to the patients to understand, where their travel history was or where did they grow up or where did they work. All those things lead to, certainly like Sinclair was saying, problems with mold exposure, which is like so prevalent, it's hard to describe how prevalent that is. And then I always find, and I'm anxious to have her shed some light on this, like what are some nice historical pearls to always ask patients or patients can think about that will help, maybe help them clue in their providers. I mean, that's totally fine with me, helping the doctor out. I appreciate that all the time.
You'd be one of the few, huh?
I'm happy. My tagline is, if you listen long enough, the patient will tell you exactly what's wrong with them. You just have to listen long enough and intently enough, and they will tell you. Parasites are real. Inflammation is common. Misdiagnosis online. Yeah, that's pretty common. If you're experiencing unexplained symptoms, boy, that's a loaded one, isn't it? So traditional blood work, as we've highlighted, typically will not show this at all. And I've had people come with stool, ova, and parasites, the traditional ones that are quote unquote normal. But if you just listen to their history, like it sounds exactly like they got traveler's diarrhea, it was never treated. So the most common thing then would be like an Entamoeba histolytica infection that's not been treated, which is easy to see and probably one of the easier ones. That's that's a bunny if you get one of those. And then I always 100% go to gut. I don't think about the face. I mean, this will be something that I guess, as a one-off you would think about. I always think about what is your genetic toxicity capability and what's your burden and how long you have that burden. And then that leads to what Sinclair and I see clinically a lot. And then I always prioritize sleep above everything else. And although I try to tell people to lead a less stress-free life, I'm not the person to ask about stress. So short of that, I'll take a couple questions off the lives before we drop into drrobscircle.com. So everybody can go to drrobscircle.com, drrobscircle.com, and join for free right now. And you can finish, and we're going to take questions. I will stay on as long as possible. We're going to give Sinclair a break because she's been ill. So we're happy just to have her on. I'm going to see if there's any questions we can take real quick. Children in South Florida get parasites via unsanitized, treated sand. Okay.
Yeah, yeah.
My niece caught parasites in Costa Rica as a nanny and took her years of antibiotics, etc. to get rid of. Yeah, we can talk about that in a little bit too. Why do people send a request to join my live? I find that weird. What else?
I don't think they know what they're doing.
Yeah.
We're all just trying to figure out the social media together. Nobody knows.
Somebody said I was under a rock. What's happening? Okay, we're gonna go to some of these other questions. Oh, it's so cute to be on all these things at one time. If you can't see me in frame, it's because I'm trying to answer questions on 5 phones. Just give me a moment.
I know, I'm so impressed with your multitasking.
Oh my God. I can't even keep up with all these. There's a bunch of people that joined, but they're not asking questions. Okay, so we're gonna chit chat for a minute while everybody goes to drrobcircle.com and joins. It's free to join. You're gonna join the live stream there. The Q&A will be live there. We will not hold anything back. I will discuss all the things, and Sinclair is more than forthcoming. So jump
I think one
over.
of the most important things that you said so far that I want to expand on before we, go inside the secret spot where we are circle is you said something that is really loaded and really important for people who are trying to figure out their health and have mystery issues right now. You said you have to go to the symptomology because those parasite tests, those gut and stool tests that are so popular right now, they have their limitations. So just because you come
always.
back with a negative doesn't mean you are clear of parasites or you don't have a microbiome issue.
Yep.
And pathogens and biofilms aren't driving a ton of your symptoms.
Yep.
And even if they do show up on qPCR or shotgun metagenomic testing, that's the stuff where you put a little smidge of poop in the vial and you ship it off and you cross your fingers. And it's not cheap. It's hundreds of dollars. And you're still going to get a very limited picture of what's going on in your gut.
Oh, we're going to talk poop in a minute because I've done the poop. But it's very true, right? So I think it goes back to remaining honestly, Sinclair, I think what's happened is if people aren't curious, meaning the patient's not curious, and their provider who sees them isn't curious and isn't like trying to figure out, because when it's not fitting the pattern, that can frustrate people.
Mm-hmm.
Well, almost none of my patients fit a quote unquote pattern. Right? They all have commonality, but it's not the things I was taught. It's the things that came about after I finished, like the completion of the genome project. Like, people now are super spoiled.
Yeah.
So the thing that we're doing right now didn't exist when I was in medical school. And we used to have something for all you young people listening called CDs. And that was what the National Library of Medicine was housed on. And you would load them and you would search the literature for the topic you had a query about, like a question about. That's how you learned. You had books, they were in a library. And then this fancy thing called the National Library of Medicine, which of course nobody had access to, they put on CDs. And we thought, oh, these are on CDs. We could, you have to sit there and load remember the racks where you had you could put 5 CDs or 4, whatever it was. And then all of a sudden the internet came. The genome project was started, finally completed in 2003, I believe. And basically the holdup there was the computers. And so the joke today I told Sinclair was, I had my Manus AI agent this morning evaluate my website and tell me it sucked. So while I was operating today in between cases, Manus AI made me a new website, and it's live now. You can go to my new website. It was made this morning by an AI agent. I don't think I would be. I would have never thought I could say that. I mean, that was like, I wouldn't even thought that like 6 months ago.
Yeah, now I just feel old.
Anyway. All right, we are going to go into Dr. Rob's circle. And I'm going to see how many people do we have in the chat.
I think we should take time to talk about, MCAS stuff, because you said a mouthful with the mast cell issues and the flares, histamine sensitivity. What is the link there between biofilms and parasites?
Yeah.
Why would somebody with breast implant illness be more susceptible to that? That doesn't seem fair, but it's certainly what's happening.
Yeah.
And I also think that we should make time to talk about like some of the gut and digestive symptoms that people often come to us with, only to discover, it's not just SIBO, it's not, this immune dysfunction. It's actually this overgrowth of stuff that's running the show.
Absolutely. All right. We're going to go just a circle. All right, that one's done. I always have trouble ending the live on TikTok for whatever reason. End now. Okay. Perfect.
I don't even know